What was this right here? Going up from the...
This is the caudal mesenteric. So there's the cranial, which goes to the small intestine, which is this one right here, which goes to all this mess, and then the one that goes to the... For veins, you have, I think they call it anterior vena cava and posterior vena cava. So from the anterior, you have the brachiocephalic veins, and you have a left and right. So that's different from the arteries. The artery, you just had one. Here, for the veins, you have two. Okay. The brachiocephalic, there's a little branch that's called the bijugular, but you don't need to know that, so don't worry about it. But basically, let's see here, let's do that. There's a subclavian. It's not dyed well at all on this animal, but it's right here, this one. But again, it's the same concept. It's subclavian until it gets past the first rib, then it's axillary, and then brachial. And it's on the same side here. So here's subclavian. Once it's past that rib, if we were to cut this open in the armpit, axillary, brachial. Then you have your external jugular vein, which is this big one right here. There's an internal jugular vein. I'm not sure if you're going to see it. Again, left and right. It's really, really tiny. I think it's right here, and it's been kind of snapped.
Do you need to know that one?
You do need to know it, and in some cats, hopefully there will be some that are visible, but it's tiny, tiny, tiny. And it's just kind of running with the common carotid arteries. And it's not really that visible on this side, maybe right here, a little bit. So if you don't have that visible in your cat, make sure that you see a cat that actually does have it. So that's that. Yeah, internal, external, that part. There's the azygous vein. So if you just push over the lungs on the right-hand side, you'll see a big vein that's kind of running down here, and it serves the ribs, and that's the azygous. So that's different from the posterior vena cava. Alright. Posterior vena cava. There's big, big renal veins in this cat, left and right. There should be gonadals, but they didn't die for some reason, but there should be. And then down here, actually just saw that on the board. So for the iliac arteries, we had this setup, where we had external and internal, left and right iliac arteries. In the cat, it's a little bit different. First, you're going to have a common iliac artery, vein, and then it's going to branch off like this. And that's going to be external and internal. External and internal iliac. Okay. And the externals are just kind of go down and more medial. And then once this gets past the leg, into the leg, that's femoral.
What should mean internals? Internals go medial, isn't that?
Yeah, did I say
I thought you said externals.
Sorry. Internals are more medial. And they go, they're going to go deep. And then this will be external, will just kind of come out into the leg, become femoral veins. Now I don't have blood. Can I get a box?